And good evening to everybody. It's lovely to be here again. We're on session 5 of the Maternity and Midwifery Hour. My name's Sue Macdonald. I'm the curator of these hours and of the Maternity and Midwifery Festivals. And there's one coming up in November, so wait to hear about that. These sessions, as many of you will know, and if it's your first time, you're going to know now, they were designed to provide some continuing professional education and development opportunities for midwives, student midwives, people who want to become midwives, people who are just interested in supporting maternity services. And they're accessible now today, even as we're speaking, and also you'll be able to access this at a later date if you want to replay anything. And I want to just say huge thanks to Matflix, who the video streaming from the maternity experts. They're really the people who look after the CPD for us, and this is an ideal resource for those of you who are coming up for revalidation. I'm feeling very smug because I've just done mine not long ago, but it's a really, really good resource if you need to update on things maybe you're a bit rusty on. Loads in the back catalogue for you. Anyway, tonight I'm really delighted. I'm being joined by Mel Radford, Senior Midwife, who's a continuity of carer implementation lead in Newcastle. I want to say Newcastle, and I don't know what that's from, but that's from up north. And Dr. Anna Barham, who's from UCLan. And I'll do an introduction, proper introduction shortly, but welcome to both of you. I'm really pleased you could be with us. Hello.
Hi, thank you.
And we're going to have a just surprise, and those of you who've picked up the ads earlier, we're going to have a discussion on continuity of care and maternity care with a focus obviously on COVID-19 times, because that's affecting all that we do at the moment, and including how we can develop models to enable student midwives to really get the skills and confidence so that when they qualify, they can just breeze in and come and join all their midwife colleagues. But before we start, I'm going to start with a quick moment of the week or the summer. And I thought I'd start with Mel. Do you have a little moment of the week or a moment of the summer, Mel?
I've had a moment of the day.
Whoa.
Yeah, so today I had to go and have a COVID test. Ooh. And so today's been pretty odd, and I went, and I have to say that the service was amazing. They were so efficient and I was so impressed with them. I was in and out within 5 minutes. They were amazing, and they were so reassuring and lovely, and all the information that I was given about how to stay safe was so perfect. I came home and thought, wow, I'm so impressed with the service. So yeah, a little bit worrying, but I'll find out tomorrow, and then hopefully back to work.
That's fantastic. That's so positive, Mel. Because there's been so much in the media about people being sent off from London to Dundee or whatever to get a test and waiting for ages for results. So that's fantastic. Thank you for that. Okay, how about our Anna?
Hi, yeah, I suppose I could say a sort of similar story that, like Mel, I've had my test and it is actually positive. So I'm actually feeling today, I've had some better moments today, feeling a bit better. And my positive of the week is that despite those challenges, I've launched a really exciting new MSc module and got fantastic students on there, MSc students, and some fantastic midwives studying enhanced critical care or enhanced maternal care and really timely, I suppose. So it's been a positive week, sort of linking in with some fantastic anaesthetists and critical care nurses and midwives that have been helping with that. So I've really enjoyed engaging with the students, even though there's obviously the challenges of teaching and organising things when you're feeling a bit under the weather.
Fantastic. Just keeping going.
Yeah, just grateful that we can continue obviously with things because of the online platform.
Yeah, that's fantastic. And thank you very much for coming when you're obviously feeling rough. And I hope we can make you feel perkier. Okay, well, thank you to both Mel and Anna for those moments. And before we start the session, I always do say this, but I want to send good wishes and thanks to everybody who's looking after or supporting people who've had COVID or have had it and are recovering. And our thoughts are obviously with the people who've lost people, because that is a terrible, terrible time for all of you and families and friends. And many people will know other people who they've lost, and that's really sad. And we're also sending some healing thought for people who are suffering at the moment from COVID or this long COVID, which seems to be a really bad thing to be getting, and it's especially, I understand, hitting women more than men and lasting weeks and weeks, and we'd like to have a session on that maybe a bit later in the season. And it's a very difficult time for many people in the country because of the restrictions that have been coming in over the last few days. So at least some people will be able to join us because they're stuck at home and they can't do much else. So welcome to those people if you're one of those. Also, big thank you to all the NHS workers. And I think the trouble is, as we have this second wave, maybe people aren't going to get the sort of love and thanks that they got the first time round. But we still love you, and we still say a big thank you to everybody who's working their socks off. People who are having mask problems because that the PPE is so tight and uncomfortable. So we're with you, and thank you for all that you do, and all the key workers too. Okay, little bit, and now we're moving on to this week's news. A little reminder, get your flu jabs now. They are available in all good health services everywhere. And I know that the take up this year seems to be quite good. So do take the opportunity of getting a flu jab if you can. It's still Black History Month, and there's still some really good features. I've seen quite a few things on Twitter and Facebook, and do take the opportunity to watch some things. There's a really good film about two escaped Black women, enslaved women in, I mean, must be Victorian times, and it was in Scotland. Really good clip. So if you get a chance to see that, it's only 17 minutes, really good. I should have put it on the resource sheet, which will be coming along later, and I'll find the clip and I'll put it on there so you can watch that. It's also Breast Cancer Awareness Month, so make sure you're checking yourself for that. It's also Down Syndrome Awareness Month too. And it's also, today was the start of the Fab Change 20 share. If you're a Twitter person, you'll know all about this. This is Roy Lilly and his Fab Academy. Really good sessions on all sorts of changes that are going on in all over the NHS, not just in maternity care, but in nursing, in general medicine, in hospitals, in community. And you can access it after today. They had live sessions today, but I understand you can go into the program and check that out over the next few days. So that is really fantastic. Okay, and I needed to say there's something on pressure ulcers, which might not sound relevant to midwifery, but it might be, and also wobble rooms, which we have talked about before, which could be relevant. News from the RCM, there's a student survey out which said, surprise, students are stressed and reported having insufficient time to study. This was carried out a bit before the COVID issue, but it has relevance now because obviously that's impacted a lot on their studies. And they obviously had financial issues on their programme, and the RCM are calling for 3 commitments from the UK governments: ensure all newly qualified midwives students can move seamlessly from training to employment, which Anna, I think, might talk a little bit about. 2, conduct a wholesale review of financial support for midwifery students with a view to providing maintenance grants which reflect actual need. Hooray, at last. And also provide comprehensive mental health support for midwifery students. So these are all things we'd absolutely agree with. Okay, and they've also got, the RCM have got a new research and development strategy, which will be of interest to many of you. Okay, well, I think we'll move on to the main meat of this evening, which is continuity of care, which in a way it's almost like a taken for granted for me. So much of the research, so much evidence to say that it's a good thing for women, for their babies, for their families. And guess what? It's a good thing for midwives, for student midwives too. We need to look at why it's not happening wholesale, maybe, and look at what's been happening. And Mel, I know, is going to share this. So I'm going to, without really any further ado, going to introduce Mel Radford. She's senior midwife. And before, I think this is interesting, before becoming a midwife, she worked as a music promoter. I think we'd have to have you on a program just to talk about that, Mel. She then studied for her BSc and her MSc at Northumbria University, and she's been delighted to be able to deliver some sessions to midwifery students there now in a teaching role. She's worked in many settings, held a role as a PMA. She's worked on the Better Births workstream for continuity of care, and she's now a continuity of care implementation lead at Newcastle upon Tyne Hospitals NHS Trust, and proud mum to 5 grown children. So I'm, without further ado, Mel, the screen is yours. Welcome.
Oh, thank you, Sue. That's lovely. Nice introduction there. Yeah, thank you very much for having me. It's lovely to be invited along, particularly now when, you know, we're not going to conferences and seeing everybody, and we do those fantastic catch-ups and we do networking, and yeah, I'm missing those times. So this is great. It's great to be talking to other midwives and others that are really interested in maternity services. It's wholesome and it's good for us. It's nice to know people are out there, and that there's lots of us that care about what's going on. So yeah, so I was asked to talk about continuity of carer. I'm currently working, as you quite rightly said, in Newcastle. So yeah, I'm at Newcastle upon Tyne, and we're in our LMS. We've got 2 neighbouring LMSs that we work together, 3 of us together. So we're all tightly bonded together. But anyway, I guess what I was going to start with really is that we're 4 years down the line, and it doesn't feel like 4 years down the line, really, does it? Because it's gone really fast. But I'm still quite surprised when I'm going along doing staff engagement. I'm always surprised when I hear that there are midwives that think that continuity is like continuity of care is a flash in the pan. I'm always really surprised by that, because I say to them, but you don't think Anti-D is a flash in the pan, do you? Anti-D is not a flash in the pan. You know, how can you possibly compare the two? I said, if you had a medicine or something, a prophylactic that you knew was going to do some good, and you had all the evidence for it, what would you do with it? Well, we would give it. Well, you mean like you give Anti-D? You mean like you might do some antibiotics? And well, yeah, there's absolutely no difference. There's no difference between if we have a medicine in a syringe as midwives and we've got continuity of carer, because all the evidence is there. It's unthinkable. And of course, the rationale behind why people are finding it a larger obstacle is it's because it's a cultural change. And I think we really need to focus on the fact that it's a cultural change for us. We get some of the midwives who've worked previously, historically, they worked around change in childbirth and they worked in teams. And again, we have to say to that, we've got the evidence around how we introduce it. We've got the evidence around the numbers, the way that we can introduce it to make it sustainable. So this level of engagement is, it goes on all the time. It's for me, it's a daily conversation. But anyway, so what's happened with us? Well, clearly the pandemic has put a cavern in where we were at, because we had I remember Jackie Dunkley-Bent saying when we first started, she was saying those that can, encourage those that can to try, and we'll encourage those midwives, and they'll be innovative, and we'll go with it. And she was absolutely right. We can see up and down the length and breadth of the country, we've got these innovative midwives who are the ones who are willing to give it a go, and they've given it a go, and they're amazing. They've got amazing stories, amazing successes, and the pandemic hit. So I firmly believe if the pandemic hadn't have hit, we'd have had a ripple effect from those that had introduced models that were successful in terms of safety for the women and in terms of job satisfaction for the midwives. So I do believe that, like, it hit like a meteor, and it paused everything for everybody. And so that ripple effect, that engagement effect, which is probably the most effective, because if your neighbours and your colleagues are being positive and have positive outcomes, that is far, far more effective than any engagement I can do with you. So having said that, that's where we're at. We need to rethink about how we engage, and it's no mean feat. And I know there are implementation leads up and down the country as well. And we've tried lots of different things, but we needed to think a little bit left field. So what I thought was, initially we'd been talking at the LMS about maybe we could do a film between the three of us. There's implementation leads in all our provider trusts. We thought that would be quite good. Pandemic hit and that kind of stalled it. But actually I got to where I was thinking I need to get face to face with the midwives. I need the neighbours to come and tell us what we're doing, but I can't do that. I can't have socially distanced premises. We don't have anything big enough for big days out. We can't really facilitate huge study days. We're in the middle of a pandemic. I can't really justify saying, can I please take out my midwifery workforce to come along to these events? So what I had to do was think differently. So yeah, films, brilliant idea. Take them to the midwives. If they can't come to us, we'll take them to them. Take all these speakers who can't physically come and ask them to do some films. So we have a saying up here, and that's shy Ben's getting out. So I just thought, right, you know what? I've got some great colleagues up and down this in maternity. I've got some fantastic colleagues. I'm going to ask them. I'm just going to ask them if they'll do us some films. And I cannot tell you how overwhelmed I was with the response, because everybody was really positive about it, and everybody said, "Ooh, yes. What exactly do you want me to do?" So I say, what I really want is something really positive. I'd like whatever you can give around implementation of continuity of care, or what an experience you've got, even if it was like, hello, we're right with you, we can't come and physically see you. So anything you can give, really. And I have to say the response was stupendous. So I know that my colleagues want to know what the neighbours are doing, because I like to twitch my curtains and know what my neighbours are doing. And I certainly want to know what my neighbours are doing in terms of my professional capacity. So whilst I knew, because I have got my leads and my contacts in my local providers, I know that the midwives on the shop floor and the MSWs and the obstetricians, they haven't really got a handle on what's going on, and we needed to showcase it. We needed to spread the word. So I think if we get opportunity, I will send you the links with some of the films, but I would absolutely need their permission before sharing them, and that's why I haven't shared them tonight with you. So I will individually go and ask the contributors if they would agree to it. So that's why I'm not sharing them with you tonight, but I will ask. In terms of contributors, excuse me, we had Sarah Wall, who is our MVP service user rep for our LMS, for the Northern LMS. And Sarah gave, excuse me, a marvellous feedback in terms of what she'd got from service users. So she'd done a survey and she was able to feed that back. So the midwives were able to drop in and see that and hear that. Trixie Macari gave us absolutely fantastic, really upbeat, supportive video. And that's great, because she's new to us, and it really forged that beginning of that relationship. And I know it's going to be a relationship that's just going to go from strength to strength. It's about reducing that gap between the shop floor midwives and our national team. Absolutely, it really does that. It brings it back in, it makes it personal, and that was really important. In terms of our neighbours, Lucy Findlay, who's me, but down in South Tees, did an amazing video for us. And I know that our midwives loved it, because what they really wanted to hear was the nitty gritty. What models have you put in? How many midwives were you doing it? Whereabouts are you doing it? She can relate it to places that they know, that they're familiar with. And actually some of our lot lived down there. So that was really great. Anita Scott, who is the North Tees lead, did a fantastic video about their single point of access. So this feeds in brilliantly to Better Births around, it isn't just about continuity of carer. There's lots of work streams within it. And their single point of access was really interesting. Our lot obviously compared it, our lot go through, our midwives get their women booked through GPs. That's their referral. So it was really interesting for them to see, everybody does it slightly different somewhere else. So that was really great for them as well. They got to know about that. Up in Northumbria, just up from near where I am, the Bright Beginnings team, and they have a team, a continuity care team that's based in Ashington, and it's an area that's got high deprivation, and they're seeing great results. So for my staff to see that, because it is really close to home, really it gives it a tangible reality about what's going on, what's happening with the neighbours, what can we do. So that was really good. And then the fantastic Catherine Hardy, who is our programme lead for LMS, I have to say her video is so brilliant. She has gone through changing childbirth. She did, the pump prime money when we introduced teams back in the day. She's gone through all that. So she's got that credibility. She absolutely is a practicing midwife, so she can give that credibility around the research, the rationale as to why we want to do it, and then she moves it on further in her video around professional responsibility. It absolutely superb, as she covers all aspects. So for me, Catherine's video is the jam in my sandwich of montage of videos. Catherine talks about in that video about what we're doing as a region. So as a region, we've got our layer as providers where we're doing continuity of care, and we're implementing individual aspects around that. We're all doing something slightly different. But underneath that, behind that as a region, we've got a piece of work going on, which is us looking at it from a regional perspective to see what we can do about implementation from a regional perspective. So very much about blue sky, blue horizon, looking around what can we do in the future to make it a sustainable programme. And in the future, we're thinking around cross-boundary working, we're thinking around shared guidelines. Obviously, things like the network, we already look at safety and shared guidelines, but this is a serious piece of work that we've done hours and hours of observations in all our providers. We've gleaned data around when births happen, what the use of midwives' time is. It will come as no surprise to anybody about how midwives use their time around use on admin, travel, and so on and so forth, and actually how much time we actually spend with our women. So it's a huge piece of work, which is going to help us inform the background to what we're doing. But anyway, I'll bring you back to my films. So the rationale behind having all these films is that the midwives are able to just drop in during the course of their day. If they've got a coffee break, they can drop in and they can see it. I don't expect them to come for the whole day because that's unrealistic. And I'm taking the videos out to the community basis as well. And so really it's a case that they can do bite sizes. They're not going to have to sit through the whole day. And I'm going to be able to do it on a repetitive whole month. So I called it Oktoberfest, but in reality, it's going to be Novemberfest. It's going to be Decemberfest. I just needed to make it accessible. I needed them to know how much great work was going on. They needed to know what the neighbours were doing. They need to know that it's successful. I did put in a load of the YouTube videos from our national friends as well. So South Yorks and Bassetlaw, Hull, who are our buddies, I put in one of theirs. And I'm really able to tailor it. So when the midwives come, they go, oh, I really want to know what the midwives think in Hull. So I go, that's great, I've got them, I can show you that. Oh, I really want to know what's happening in Sunderland. I want to know what's going on in Darlington and Durham. And I go, well, that's great, because I've got Amy Matthews who can tell you all about it. So it's worked really well as bite size. It is perhaps an unusual way to get to the staff, but I would absolutely recommend it. I haven't got to all my staff by any means. I'm going to be mobile with it. I'm going to be going out and seeing them. and hopefully getting the message out there that it's good, it's completely evidence-based, it can be good for you as well as good for the women. So yeah, that's my experience around trying to promote continuity of care in COVID times. You've got to do something slightly different. So that's kind of where I'm coming from. I could talk to you all day about it, Sue. Honestly, I haven't even scratched the surface of what we're doing. There's so much good work going on. But yeah, that's where we're at now. That's where we're headed. And I'd be more than happy to share some of those videos when I've got permission from the people that did it. Jane Harker, our RCM rep, said, please don't show that again. She was brilliant.
No, that's really good. I mean, it's whetted our kind of appetite to see these films. I mean, I'm assuming that you'll be able to release them onto, so people can get them on their mobile phones at some point, because that seems to be a big thing to do, doesn't it?
I think I'm going to get some help from the LMS. Obviously, once I've got permission from the contributors, our fantastic chief midwife, Tracy Cooper, and Claire Keegan and Mel Hudson did us a video. And I'd need permission from people before we got to do that. Yeah, but there's plenty, there's so much content. I think as an LMS, we would want to produce something that's a little more refined and polished. I think the AHSN are probably going to help us with something like that. So yeah, fabulous. That would be great to get something. Yeah,
fabulous. Oh, that's great. Thank you so much. And I love the continuity of care as being a medicine. I think that was fantastic. That's such a good analogy, because you know that it's an intervention and it's a successful intervention. But I think to use that analogy is really strong with people, to get them to think kind of differently, especially when you're dealing with, as you say, a cultural change. Fantastic. Now, for those of you who are watching, this is your chance to think about any questions you want to throw at Mel. Remember, we're going to have a little discussion at the end of the session. So any questions, if you can send them in, and they'll come through to me, and then I can pass them on to Mel and Anna in turn. So thank you, Mel, for that. That's really good.
Pleasure.
And really exciting. I want to see those videos immediately. But I'll wait till you've got permission. That's fine. That's grand. Okay. Well, thank you very much. And we'll now move on to, I have to always be very mindful that an hour is a very short time. I used to think an hour was quite a long time, but since we've been doing these hours, it just goes like that. So I'm going to then be very pleased to introduce Dr. Anna Byram, who's known to many of you. She's a senior midwife educator at the University of Central Lancashire. She's a researcher as the part of the Thrive Centre at UCLan, also evaluating continuity of care across Lancashire and South Cumbria and within student education, which is what she's going to talk about today. She's also director of All for Maternity and publisher of the Practicing Midwife and the Student Midwife Journal, and she's going to be talking about students and continuity of care. So welcome, Anna, and thank you for coming. The screen is now yours.
My presentation with you, it's so wonderful to be here, and I'm really grateful, especially to hear from Mel and all of the amazing work that you're doing, and the innovative approaches to communication and creating communities, and really supporting midwives that are there working hard implementing these models, but also the midwives working hard supporting women so that they can understand the opportunities that are there for us to work in ways that we kind of always long to in the hearts of our practice, really. So it's so wonderful to be here, and it's a really special interest area for me. It was my very first job when I qualified from Birmingham Women's Hospital. I did my training, and then I went straight to a continuity of care one-to-one midwifery team with Sure Start Kennington at St Thomas's Hospital. And I was really lucky that my first boss as a new midwife was Jackie Dunkley-Bent. She was my consultant midwife who had secured this new team. And I was the very first continuity of care midwife at St Thomas's at the time. working all on my own, but then I got buddies, and one of my really good friends, Mel Denton, became my buddy, and we absolutely always talk about that time being the best ever time that we had in our careers, working clinically, supporting families throughout the continuity, driving home birth rates up, more importantly, building relationships, trusting relationships with women and their families, supporting optimal outcomes, and loving being there, practicing, feeling like the Call the Midwife. It was before that book and film came out, but it was just really wonderful for us. So now I'm working in education. For me, I want to explore the potential of relational continuity of care for effective learning and practice the future midwives. And that's the sort of focus of what I wanted to talk about today, really, because I loved it so much. I wanted to be able to find ways for midwives of the future to learn about how to do it and get the skills needed so that it became part of their everyday practice. So we know the drivers for change. We've had them around, like Mel said, for four years and beyond. And actually, Sue Down sent some things around our GISCmail research group about sort of evidence and sessions that were running in the 1980s around continuity and before changing childbirth. And we know that this is the model. It's historical model. It's about being in the community and being there for families and learning about the families that you're caring for and feeling connected. But it's also supported so brilliantly by evidence. But like Mel said, we have faced a lot of challenges, and that has been a shame to see that with all of the great work that's taking place. We know there are continuing service demands, constraints and staffing challenges, especially because of COVID and the impact that continues to have. And so we've got to find ways to address those collectively. And one of the sort of things that I feel is giving us a real opportunity from an education point of view are the amazing future midwife proficiencies, standards of proficiency that have been developed. And obviously now universities are working really hard as they recover from COVID to kind of start to implement these standards. And they provide us a fantastic opportunity to focus down on continuity of care and carer as one of the 6 domains. And we need to find ways to embed this meaningfully into our curriculum. We often, most curriculums would have an aspect of the curriculum that focuses on case holding and continuity elements, but it's how can we really meaningfully move this forward to respond to what our workforce colleagues and staff and people like Mel that are working hard to implement this for midwives and for women in practice. How can we support you from an education point of view to supply students that are qualifying with the skills needed to run in self-managed teams? So at UCLan in 2012, we revalidated our programme. So it's a sort of while ago, and we've been waiting sort of with bated breath for these new standards to kind of launch and change and update our curriculum. But we've already had a case-based learning, woman-centred, person-centred curriculum. And we've kind of done that theoretically. So students follow women all the way through their theoretical journey. They don't do A&P on a Monday and then sociology on a Tuesday. They look after a woman and they go off and learn about those aspects around that woman and that family unit. But what we found is that when they go off into the amazing trust maternity units that we place them in, there can be variable placement learning opportunities for them because of the way that the services are structured. And often, to be fair, we place students in the service and they follow the service. And I started to think about 2 years ago, I went to Australia and they've really embedded continuity of care into their education system, especially at the Griffith University with Professor Jenny Gamble and her team. And I started to think, right, hold on, we're doing like this case-based learning curricula theoretically where the students follow women and families and people, but then they're often going off into their placement settings and following the service. And you think, well, what kind of midwives do we become if we follow the service? And we know that there's a lot of tension and pressures for midwives to serve the service rather than maybe the families in their care. So what we're trying to do at UCLan is now move to learning through continuity. So actually sort of saying to students, what we'd like you to do is to follow women. is to meet women, become their continuity of care student. Whether the service has a continuity team ready for you or not, you can still just follow women, because we've been doing that successfully in smaller numbers for quite a long time. And what then the student can do is they can then go with the woman to those placement areas and experience all of those placement areas alongside the woman. So we're still getting all the experiences that the students need to meet their EU criteria and course requirements. But what's crucial is at the heart of our curriculum is the family, is the woman, is the baby, is the person. And that's what we want to centre around. And wrapped around the woman is the student for us as educators. And then wrapped around that is all of the midwifery teams and the service, and obviously us as educators. We know that these approaches really make a difference to student learning and experiences, and we've also seen from this work in Australia that it's having an impact on women and families as well. And we know that it can transform student learning experiences and environments. It's most important for transforming the future workforce. If we're getting difficulties to implement this, why don't we make sure that we're recruiting student midwives that want to work in this model, and then helping them to learn the skills to work in the model when they qualify. And obviously it helps us to meet the future midwife proficiencies, whilst also, and this is crucial for the UK, is obviously across England, we're needing to recruit more students and train more students, so we have more midwives for the workforce, and we're going to be training 1,000 more students every year. So this model will also enable quality and capacity, because there are lots of women having babies. So as long as you can follow women and getting your experiences, you can have lots of students there following the women and families. So what we've created at UCLan, we're going for validation in November, is a gestational curriculum, a curriculum that allows the students to go out from theory to meet women along the women's journey and come back into theory to learn how they can best support those women that they're caring for. And this is just the area. So they're going to be being with woman, person and family. And we're running 2 research projects at the moment. One's about enabling effective learning environments using CLIP, which is a collaborative learning in practice model that was brought in for nursing from the Netherlands, and it's been implemented successfully at John Paget University hospitals, and also in nursing at one of our local trusts in Preston. Lancashire Teaching Hospitals have helped implement this across all of nursing. We've piloted it this last year in midwifery on the wards, but what we'd really like to do is pilot this coaching and peer learning approach using continuity. So we invite students in 2nd and 3rd year to come together in small groups, which will mirror and mimic the continuity team approach, so they can learn the skills of working collaboratively and supporting each other to prepare for continuity in practice. And this is what, Mel, you were saying, it's a culture change. So we feel that we need to change the culture of learning throughout midwifery and beyond to help really prepare students. Alongside that research project, we've also got a second research project where we're evaluating locally in Lancashire and South Cumbria our continuity teams to learn what's working well, and in an appreciative way, what's working well, and how can we create resources and packages and modelling that we can then share throughout the local maternity system and obviously regionally and beyond. So it'd be so good to connect with you, Mel, and learn how we could, across the borders, we can kind of communicate and share ideas together. This will be a 6-month project with my colleagues, Professor Sue Down, Jill Thompson, and we've just recruited recently Dr. Claire Feely as well, and we will have clinical staff involved in that. So it's brand new, and we're going to be looking over the next 6 months at this. But what we'd like to do is combine both of those 2 research projects for the next 6 months, so from March onwards next year, and pilot this continuity of care approach with students in a collaborative learning environment. And then what we can do with that is learn how we can then implement it with the new standards that will be implemented from September 2021. So Carol Mashadi, our lead midwife for education, is leading that curriculum development. And then we're working really closely with the local maternity system and our programme director, Vanessa Wilson, and obviously the workforce work stream. So Catherine Sim from Health Education England and Joe Doherty, the project lead, we're working really closely, and with our amazing continuity of carer leads. So Jane Cooper and Jess Sanford and Ruth Deary. We've got a whole team of fantastic people like you, Mel, that are working really hard. So we want to find ways that we can build and integrate students alongside that. So that's kind of where we're heading, and we want to make sure that we learn before we fully implement the kind of things that students will face, and to make it meaningful learning for students. So that's kind of what we're hoping to do. And it'd be really great to build connections with anyone else that's kind of got these ideas nationally. If they wanted to get in touch, it'd be really good to find ways that we can replicate this in different areas and support each other, so we don't all have to create the same resources. We could share them, couldn't we? And I know sort of Claire Matthews, who's our deputy head of midwifery, chief midwife across our region, is working really hard to strengthen continuity of care, and working really hard to do that, especially in vulnerable communities and communities that can really make a difference. So I'm really looking forward to connecting the dots and building a community of practice beyond our local region. So hopefully that's given some insights into the things that we're doing.
Okay. Thank you very much, Anna. That's really interesting. It's a sort of the community idea, and also the gestation model. I love that, and getting students to follow through with their women, which sounds fantastic. I've got my eyes will go this way because I have another screen and I have questions coming through. But I did wonder, Anna, do the students seem very keen to do this sort of model of learning?
Yeah, so this is part of what we want to do with the pilot, is to kind of work out with the students, do kind of like a co-production approach over the next year, if we can do that, so that we can learn and share. We know from the evidence and from the students' experiences with doing case holding currently that they enjoy it, but at the moment it's really impaired by it not being the centre of the curriculum. So they're often feeling really pulled with lots of competing demands. So they have to often do the case holding experience bolted on whilst they're also doing other placements, and they're also doing theoretical learning. So we really wanted to start with the course plan and look at how we can really make sure that the course plan centres around the woman first. So that's what we mean by that gestation curriculum, is when would the student need to see the woman, thinking about the usual schedule of care. Obviously we know there'll be variations, but as long as the student can be prioritised to always go to see the woman first and then do the learning around the woman. So that's kind of not to move away from that binary theory practice. We wanted to say, look, the best learning you can do is with women and families. And so how can we amend what we're doing to enable you to do that? And students have, yes, been part of our preparing our programme. We've asked what they think. Obviously, like anything, they have questions. What would this mean for childcare and managing my time? But we think those skills are really crucial to develop whilst you're training. Like, how do you manage this? Can we try out variations whilst you're training, so you learn what kind of model you need to work in to suit your family life? But speaking as a case coding midwife, continuity midwife, you learn really quickly how to adapt your life, and it just flows really easily. And yes, you have busy times, but you have busy times now on shifts, so it is a very flexible model. I think it's just learning how flexible it can be when you're training would make a difference. I don't know what Mel feels about that.
Oh, I can't agree with you more, actually. I think that's one of the selling aspects of the model, is the potential to improve your working life and your work-life balance, and possibly you know, maybe that's a trick that we haven't explored enough. The idea of wrapping a curriculum around a real life gestation around a person, making it centered on that, is, to me, like, why have we not thought of that before? It's such brilliant, obvious thing to do, but why have we not thought of that before? Yeah,
that's what we felt like when we were doing it. But I think for us it was like a bit of a gestation itself, in the sense that we moved the curriculum away from that really traditional modular approach a long time ago now, sort of 8 years ago, and because we've built confidence in that being a meaningful way. I mean, it's not perfect, nothing is it, with curriculum development, but it's we could see that actually there's things that we can do, and also I think Better Births has been an amazing transformational approach, and it's brought communities together across sites, and you reflected that in what you were saying, Mel. And I think what we've done is we've learned across education and practice as well, and we're coming together as groups in these meetings, and you can see, right, if you're having challenges with your workforce, maybe we can help in education to provide a workforce that's ready with the skills that you need in order to meet the agenda. So that's kind of where it all came from together. So it's a group effort, you know.
And it's great sort of looking critically at whether we're running hospitals and running health centres, or actually providing a service for women. And that's again the cultural thing, isn't it?
Yeah,
moving away from.
I think as well, the NMC standards really do centre the woman, don't they, and family, and they really guide you when you're developing your curriculum to do that, with it being around the Lancet Midwifery series and the quality framework for newborn and maternal care.
Yeah.
So I'm flashing up the standards just in case nobody's read them. Very good to become familiar with them. And I'm sure, I know the Educationalist and anyone who's in Mel's sort of job is becoming very familiar with all of this material. Now, I do have some questions. Some have come in. I've got Joe D'Augustin, who says, hi, Mel. How crucial is it to have an implementation lead in every trust? Who do you report to, and what percentage of your job is continuity of carer implementation? Good question, Joe.
Yeah, very good question. Did you say that was from Joe?
It is from Joe D'Augustin.
Hi, Joe. Thank you. So across the northeast, each of our providers does have, and northwest Cumbria, we do have an implementation or project lead. Now, that isn't necessarily reflected across all the other LMSs. In terms of what each of us does, is very much individualized to the individual provider. Some of them, for instance, my colleague Mary over in Gateshead, she works clinically as well as managing an implementation. And some of my colleagues elsewhere have a different portfolio and have a wider portfolio. So the answer to your question, I guess, is it's up to the individual provider, but the onus is that the project or implementation lead has the focus of continuity of carer as their main source of their role. It's not a role that's a permanent funding. It's the funding for us has come through our LMS. So it will be very different up and down the country. For me, my role is purely around the implementation of continuity of carer. And in other areas, certainly they have a wider portfolio. I guess it kind of depends on where you're doing that role. So I work at a tertiary referral centre, and when you're looking at, you know, between 6,000 and 7,000 births, that has a different onus to somewhere that perhaps has a half that number. So the answer is it's completely variable. Personally, I think it's really important. I think it's good for staff to have a focus point, to have someone that they can contact. I think it gives, I was going to say credibility, but perhaps not credibility. What it gives is stability, and very much a point that, you know, this is really important. It's important. We're going to put somebody in role that's going to try and really make this move forward. Yeah, I guess it says that it's important that if you've got somebody that's actually highlighted as that person. So thanks, Jo.
Brilliant, and good answer. That's grand, thank you. Okay, I've got a question from Natalie Coop, who says, I'm applying to UCLan for 2021, good choice, and I'm particularly interested in safeguarding midwifery and continuity of care. Can anyone point me in the right direction for resources to research for my application? This person will go far. And she says, thank you. Thank you, Natalie. Good question. You've come to the right place.
Yes, I think so. I mean, obviously, I think there's a really fantastic continuity of care e-learn module that the RCM have put together that would be useful for you to have a look at. And the RCM's got lots of fantastic resources there that will be meaningful and useful for student midwives and aspiring students. And then obviously I would always like to say that there's the student midwife journal that is a fantastic resource as well for looking at learning and Matflix and all for maternity. But I think you do want to maybe speak to midwives, people that are working locally in the areas that you want to work in these models, to find out what opportunities there are. And it'll be a bit challenging at the moment because of COVID, but I would recommend that you join your local Facebook groups where women are and talking about their care. An example would be the fantastic Birth in East Lancs website and Facebook group. And then if you haven't already joined the secret community for midwives in the making, run by Ellie Durant, it's fantastic. And she also has a website, Midwife Diaries, and she writes some fantastic blog posts for you to catch up on as well.
Fantastic. And I guess the NHS transformation page, which is on the resources list, might be a good place to start, because you'll get the sort of background to where it all came from. Unless you want to start with changing childbirth, but that was quite a long time ago.
Yeah, and also Jane Sandals, you know, there is some fantastic Cochrane reviews and research. If you're interested in research, it's all in the Better Births transformation document anyway, but it's nice to be able to understand the research behind things. And often that research is actually mostly been looking at you know, does it reduce morbidity and mortality? But actually some of the brilliant satisfaction and things are captured too, but there are broader things that maybe aren't always captured in the research. But, you know, Mel and myself and people that have worked in continuity models know that it really is a transformational experience. And whilst it's always challenging at times, because all jobs, all work can be that way, actually to work and build meaningful relationship with families, and they know you when you walk through the door, and they know you're there to meet them wherever they are, whether it's in their home or the hospital. You can immediately see the impact of that relationship, and you feel it too. No longer do you have to go to work thinking what's going to happen today, because you know who you're going to meet.
No, that's a brilliant point. Thank you, Anna. Did you want to say something, Mel?
I just actually, Anna, you nailed it there. Around so many of our staff say when they're NQMs, they come into post, they go, and I just sit there and I just think, oh my, don't ask me, what am I going to take? And they get really, and you know, so actually that, I hadn't really thought about it from that perspective, but you're absolutely right. If you're coming in because you know that woman, you know that family, that's another aspect that I'm going to sell. So yeah,
I can remember driving to work thinking, who do I need to be for this family? Because they're the ones that call you often. So you can think all the way there, like what you're remembering, all their history, you know, who they are. And then you can be that kind of midwife that they need, really. It's much easier to do it because you know them, you know what their preferences are.
Absolutely. Beautifully put. Okay, another question now. I've got a question from Lola, Atiko and Ornato. Hi, Lola. You're a regular viewer here. Do you ever get students who are not keen on continuity of care? And she says, there are certainly midwives who do not want to work in a continuity model. So that's a question firstly for Anna, but I think also for Mel.
Yes. So I think for us, doing it in a full continuity approach is going to be very new for us, and for that to be the heart of the curriculum for year 2 and year 3 students is going to be, and we've still got to work out exactly what that's going to look like for those students in 2022. But we want to kind of learn together with the students. But I do think for me, it's also about recruiting students that actually want to work in this way, that have done their research, you know, and finding out, is this for me? Is this the kind of approach to being with families? But I've yet to meet a student that's come to recruitment day that doesn't want to be with women, that doesn't want to build a relationship and be there for the family in the community setting. So I feel that once we provide it in a meaningful way with the right structures, I think students are really going to get a lot out of it. But it will be challenging, because I don't think we can say that it won't be hard at times, because once you really love people, it can create emotion work. And we know midwifery is really emotional, an emotional job. So as long as we have the right support like Mel around to help us, and people like managers and leaders that can give us the support, and each other.
Absolutely. How about Mel?
Hi, Lola. Yes, I would say that inevitably one size doesn't fit all, and working in a continuity of care model isn't going to be right for 100% of the people 100% of the time. However, given what the rationale is behind continuity of care, so you have to remember what's behind it. What's behind it is improved outcomes for women, improved outcomes for baby, improved outcomes for midwives. So with that underpins it, the ethos behind it is non-debatable. It's just not, because if you're going to become a midwife, what other rationale is there? That you want the best for women, the best for families, the best for babies, and ultimately you do want the best for yourself as well. So I think fundamentally you have to ask yourself, why would somebody not want to do it?
Okay, thank you. That's great. And then we've got Jill Moncrief loves the idea of the gestational curriculum. Loves it, Anna. Does this mean that students have one woman they follow throughout, or more than one? I take it then just a very flexible curriculum delivery around this. I think you might be right, Jill.
Yeah, I think it's flexible. And yeah, I know Jill, and she's reached out. I think she's doing research in this area as well up in Scotland, and has been engaged with her at MSc Studies. But we've yet to determine it's sort of the numbers and the quantities, and that's something we're going to be working out this year. But it will definitely be more than one. At the moment, students do follow one or two families through in their second and third year, but this will be much more integrated. And what students will do is that they will have their case holding women and do it similar to how a midwife would pick up women each month and book them appropriately for them. But then they'll also, if they want to, around seeing their women and quieter moments, book in times to go into different areas and work to get experience in other areas.
Okay, that's great. Thank you. Now I've got two quite similar things. One from Barbara Montani, who's making a comment rather than a question. She's extra keen to work in a continuity team. Unfortunately, it looks like not all of my peers feel the same. It's hard when we're mentored by midwives who are not particularly keen on it. That influences students. As a comment. And then from Natalie Corden, how do you think we can shift the negativity around continuity of care? Attitudes about it all went wrong in the 1990s. Well, I've got my own view on that, but Mel, maybe you'd like to.
Yeah, good one for Mel.
Yeah, absolutely. Okay, so thanks, Barbara and Natalie. Yeah, I see it on a daily basis is incorrect. I see it, that there is negativity around it, and the argument of the 1990s. And so I would turn that upside down on its head, because we have learnt from that. And there is a huge difference between what we had and what we're implementing. And that is that we have a ratio of 1 to 36. That is that we have protection. That is that there is a structure in place so that it is not going to be a burnout situation. We are saying up to 8 headcount midwives. That is completely different. We're not saying that you have a caseload individually of 200 women. That is not what we're saying. So those protections are in place. And I understand that people have a lived experience that has given them those opinions, and I'm not undermining that opinion. It's completely valid, but that is not what we're doing now. We're doing something different. We're making it a sustainable model.
That's a fabulous place, and I can't bear the fact this hour's gone so quickly. I could listen to you both for hours, and I know our audience can. And please, if you have any questions, we'll try and answer them on live ongoing after the program, and resources will be available on the website and on Facebook on Friday, so look out for those. Next week we've got Educating Tomorrow's Midwives, so we've got a little bit more of Anna, but with her colleague Sherilyn Babolsky and Sarah Johnson. Yes. Sherilyn. Okay, so that's next week. And then we have the Scottish Festival, which will be online, not in Scotland. It's just got a Scottish feel to it. And that's on the 25th of November. So book now for that. And I'd like to say a big, big thank you to Mel and Anna, who've really talked about, and I love the way that Mel puts it: best for mum, best for baby, best for family, best for midwife. And to equip our students for this is fantastic. So thank you so much for coming and sharing your knowledge and your expertise with us. In the meantime, to our audience, thank you so much for coming as well. Stay safe and well. Look after yourselves and your loved ones. We'll see you next week, 7 till 8. So take care.
Bye.
Bye.
Thanks.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.